Thanks for watching our video today. At Inland Detox, we like to give people straightforward answers to some of the more difficult questions about drug and alcohol treatment. And in this video, we want to talk about the #1 question more people ask us than any other. It's a pretty simple question, but the answer isn't what you'd expect. The question is, why is addiction so hard to overcome? You might be thinking it's because people seeking help haven't hit their bottom. Maybe you're thinking they need a higher power. And just maybe, you might think drug and alcohol recovery programs really don't work. What we've found is that while every person seeking treatment is different, there are some common things that everyone needs to gain lasting sobriety. So here are 3 things we think everyone needs to overcome addiction. First, if you're suffering from addiction to alcohol, opiates, or benzodiazepines, and you've been using for a very long time, you'll need a medically assisted detox program to start. What's a medically assisted detox? Simply stated, it's a detox program that slowly tapers people off their drug of choice, so that withdrawal symptoms, both physical and psychological, are minimized as much as possible. We've come to understand that many people suffering from addiction don't continue to use because they enjoy the high they get, but instead continue to use just to not feel sick. This is why going cold turkey doesn't work for a lot of people. Just ask yourself, would you rather feel like you've had the worst hangover in your life, or worse for days, if not weeks, or continue using? Once you've been safely weaned off drugs and alcohol, and you no longer feel physical or psychological withdrawals, you can move on to the second step. Long-term inpatient or long-term intensive outpatient treatment is the second step in recovery. In fact, one of the most important factors in reaching long-term sobriety comes down to one thing and one thing only: length of stay in treatment. To say it even simpler, the longer you stay in treatment, the greater chance of success you have of reaching lasting sobriety. 10 days in rehab, 15 days in rehab, even 30 days in rehab may not be enough. And realizing that addiction is a disease that requires a lifelong commitment is just as important as committing to long-term treatment. And third, and perhaps the most important element of reaching sobriety, is changing your lifestyle and changing your circle of influence. People in recovery need to set strict boundaries between themselves and those that may influence them to use drugs and alcohol. Too many people go to detox, then to rehab, only to return to the exact same lifestyle they lived before, and this is a guaranteed recipe for failure. We've noticed that a lot of people that reach long-term sobriety commit to setting boundaries and changing their lifestyle before they reintegrate with their day-to-day working lives. They set a schedule of what they'll do every day for a year or more. They clearly define who they will and won't hang out with, and they stick to the plan. Addiction is hard to overcome, but there is common ground among those that find lasting sobriety. A detox plan that uses medically assisted treatment to curb withdrawals, committing to long-term inpatient or intensive outpatient care, and setting boundaries and creating a new schedule to follow when you return home. Thanks for watching our video. If you think this can help you or a loved one, please share and pass it on. If you'd like to talk to us about finding your way to sobriety, or would like to talk about getting a loved one the help they deserve, call us at 888-739-8296.